there's been an uptick of BA5 cases in Polk County. The county health department has a new initiative to track the COVID-19 subvariant, but it says it needs your help. Local 5's Mary Sugden joins us with what you need to know.
There's a good chance if you or a loved one had COVID-19 symptoms in the last few weeks, you took an at-home test. While these tests are an easy way to check if you're infected, the health department says it keeps them in the dark when it comes to monitoring positivity rates. But that's all changing with this brand new survey. With a quick swab and a 15-minute wait, you'll know if you have COVID from the comfort of your home.
We don't know how much COVID is actually in the community.
But that information isn't always relayed to local health departments, which is why Polk County's department crafted this survey.
It gives us a good indication of the positivity of COVID-19 right now in Polk County.
By filling out some basic info, like when you took your test, what kind of test, and the result, the health department says it'll get a better picture of community transmission.
It also gives us a bigger picture of what we can share with the community versus prevention strategies, what we can share with organizations and businesses, about maybe rethinking some of their policies right now.
The gratifying thing about this particular surge is, even though the numbers are high out in the community, we're not seeing a commensurate increase in the hospitalizations.
But in order to keep those hospitalizations manageable, doctors urge you to check your vaccination status. If you're under 50 and healthy, you should have a primary vaccination and one booster. If you're 50 and older or considered immunocompromised, on top of your original vaccination, you can have 2 boosters.
Unfortunately, in Iowa, I think we only have like 30% of us that are considered adequately boosted. So there's still a lot of room for people to go ahead and get boosted, because even though the Omicron variant isn't nearly as deadly or as severe as the previous variants, it can still cause a lot of problems.
Now, something else to keep in mind, if you requested a home test from the federal government, check that date. There's a good chance they're nearing their expiration date, and the health department stresses to not use those expired tests. You won't get accurate results. Mary Sugden, Local 5 News, We Are Iowa.
Mary, thank you. And new to Hy-Vee, an option to get treated for COVID while you're there to get tested. Pharmacists can now prescribe patients the antiviral medication Paxlovid, and this is for patients 12 and older who test positive for COVID-19.